I have 10 points that by the time I'm finished at the end of this video, you will be able to write a proper nursing resume. Number 1, choose a format. Choosing a format of how you are putting your resume together. It means you can put it chronologically. You can put it functional format, like that's, let's say chronological is in time. We know chronological is with time. Functional is how you have been able to work as a nurse or a nursing assistant. And you can even combine it where you can put, okay, I have been working at this job since 2005 to 2010. I worked as a CNA and I did these responsibilities. So that's what I mean by choosing a format. Most resumes, people combine the format. They like putting together their work experience with their time in a chronological order. Then we have contact information. Well, we know contact information is basic information. We need to ensure that our information and social media handles are listed on our resume. For example, we need to make sure we have our name, address, our email address, our social media handles like LinkedIn, all our professional media handles. I would not advise adding Facebook and TikTok and these things. Put your professional social media handles. For example, you can put LinkedIn, as I said previously. Then point 3, you write a strong objective and summary for the job. So basically your objective, you are telling the employer, so let's say it's me. I'm going to say that my objective of coming to your institution is to bring my experience that I have in my nursing experience, 15 plus years, to add and to gain more experience from your institution and combine it and become a nurse that is very functional and very competent and safe practicing for your patients. Okay? I can even do a summary of what my job description was or is as a registered nurse. Okay? Point 4, we're going to list all our licenses and certificates. At this point, you will say your nursing license. Let's say you're licensed in the New York State and you're applying at North Carolina, or you're applying at Florida, or you're in a country that is out of the US. You list your nursing license and your expiration date. Your nursing license has an expiration date. For example, I am licensed in multiple different places. So my first license was in Trinidad and Tobago. Trinidad and Tobago nursing license does not specifically say expiration date, but you know every year you have to go and pay to renew your license before the year end. So that will be your expiration date. Whereas a nurse in North Carolina here, you have an expiration date listed on your nursing license. In Bermuda as well, where I worked also. So different places, you check your nursing license to see when you have to renew, and the date that you have to renew by is your expiration date. Okay? Certificates, BLS, Basic Life Support, ACLS, all these different things, PALS, all the different certificates that we do as nurses, you list that in your credential area. That's where you put your license and your certificates. Okay? Number 5, highlight your nursing experience. That is very important. Okay? Your nursing experience is meaning that here I'm going to tell you where I last worked, all of the places, my job position. So again, let's say the nurse is Julie. Julie worked in Toronto, and Julie was a registered nurse at Toronto from 2001 to 2002. Then she moved on to Miami and she became a resource nurse or a nurse in charge from 2002 to 2004. So in chronological order, she's listing for you all her positions, and she will put a description at the bottom of that position of what her job description was, what she performed, what did she do during that time. Okay? Then 6, showcase your education. Like you have to show off basically how well you did at school. So if you graduated summa cum laude, if you graduated valedictorian, if you graduated with a specialty, anything that you feel proud of, this is where you showcase yourself. This is where you say, I have my bachelor's with honors and all these different things. You put that in your resume. Be proud, okay? Then you emphasize your relevant skills. So your relevant skills are what? As a nurse, you have to have you have to have people care, people to patient. You have to be able to talk to people skills, as they say. So you're supposed to have communication skills. You are supposed to have a skill of being able to educate people. You are supposed to be able to know how to do vital signs. You are supposed to be able to know how to do a blood sugar. You are supposed to be able, these are different skills. You are supposed to be able to know how to do an IV access. You are supposed to be able to know how to do a blood draw, to take blood from a central line, a PICC line, a porta cat, all these different things. These are skills that you have, that you list under the skills area, because that is relevant to your job. Do not tell them that you have the skill of knowing how to move a suitcase full of luggage with one hand. That has nothing to do with it. You make sure and give them relevant skills. Then you talk about you include now your volunteer work and affiliations. So let's say you are a volunteer for the Red Cross, right? Or you are a volunteer for American Heart Association, or you volunteer at a specific institution that is nursing something in health. You can list that there and list your affiliation, which would be, if you're a volunteer at Red Cross, your affiliation would be to Red Cross, okay? So that looks really nice on your resume, all right? Then you use action verbs to quantify your achievements, right? So in that situation, you will be able to say, I improved my skill as a phlebotomist because I am able now to draw blood better than I was initially. Or you can say, I improved my IV cannulation skills. I can place IVs. I can do midlines because you had your certificate in that, okay, in vascular accessing. So here you come now and you elaborate on yourself, on your improvement, on your status of how you are, who you are, okay? And at the end, you make sure and you proofread and customize your resume to the job that you are applying for. You do not write a resume talking about, I am a dialysis trained nurse and I am very good at accessing a dialysis port and I improve my skills at being able to run the dialysis machine, and you are applying to work on a maternity ward. It does not come together. You have to be able to modify. So at instance like that, the nurse can say that she's very good at vascular accessing, instead of saying she's very good at accessing the porta cat that the patients have. See how you make it sound more appealing? So that is how you write a resume that will make an employer want to interview you. The person that wrote this resume, make sure that you do not lie on the resume, okay? Make sure you use proper English when you you document this resume, and it is up to date in time. So it must be able to, your resume must show from the very first time you became a nurse to presently what you have been doing, okay? So that's it for today. Remember, nurses do it better. Good luck in writing your resumes. I'll put an example in the description below for you to see. And good luck on those interviews, those new grads. I know NCLEX results came out in May, so I know people have been doing interviews, getting employed. Good luck and welcome to the Nursing Task Force, and nurses do it better. See ya.